Epidurals are the most common form of pain relief given during childbirth in the U.S. Half of all moms receive an epidural during delivery. Despite being so common, most patients have many questions and concerns about getting one. The goal of this video is to explain what an epidural is and what you should expect should you decide to get one. Now, as with all procedures, there are some risks with an epidural which will be discussed with you beforehand by your care team. We encourage you to ask your nurse or provider any questions you may have. An epidural is a regional anesthetic, which means that it blocks painful sensation in a select part of your body. This differs from a general anesthetic, which typically puts you to sleep. The goal of the epidural is to block painful contractions that accompany labor by numbing the lower part of your body, usually from your belly button down to your toes. Although the epidural will block pain, it does not completely block all sensation. It makes your lower body feel like it fell asleep, but you will still be able to feel touch in a diminished capacity. The epidural typically allows you to be aware of pressure, so when it's time to push, you're able to do so but still deliver your baby comfortably. It allows you to be awake and aware of what is happening around you throughout labor and communicate with your care team. The timing of when you get your epidural really depends on the clinical situation, your caregiver's recommendations, and you, the patient. In general, you can get your epidural at just about any point while you are in active labor, which is 5 to 6 centimeters dilated. Everyone's pain tolerance is different, and labor affects all women differently, so while some moms go into the delivery process not wanting an epidural, they may change their minds and elect to use this safe, effective form of pain relief. Now is a good time to introduce your care team, who will be assisting you on your delivery day. Many of these you have met through your checkups through the course of your pregnancy, and though the names and faces may change, especially in the case of an unscheduled delivery, the roles remain the same. You will have a nurse from the labor and delivery team, a CRNA or MDA who will assess you in place and monitor the epidural, an OB physician or a midwife if you have chosen one as your provider, an anesthesia provider, CRNA or MDA trained in regional techniques will administer your epidural. If you elect to have an epidural, they will join your labor and delivery care team, often along with a nurse anesthetist. When it's time for your epidural placement, the anesthesia provider will meet you in your room, review the benefits and risks of an epidural, and will go over how it will be placed. Typically, one support person may be allowed in the room during the epidural placement, but every circumstance is different, and it is the provider's choice as to who is able to be in the room with you. You will be in a sitting position with your back curved like the letter C to the best of your abilities. This opens the spaces in your back and facilitates the epidural placement. The area of your back to be used will be cleaned with a sterile solution and a drape placed over the rest of your back to keep the procedural field sterile. Then you'll be administered a small dose of local anesthesia into your skin to numb the area. When the epidural is being placed, you will most likely feel some pressure or a slight stinging or burning sensation, but it's usually tolerable. Once the epidural needle is in the right spot, a small catheter will be inserted. This is used to give you anesthesia for as long as you need it while you are in labor. The amount of medication you receive through the epidural can be increased or decreased as needed. As long as the epidural is being used, you will be monitored to ensure your safety and the safety of your baby. It's as simple as that. From there, your care team will continue to monitor you and your baby's health and progress through delivery. Now, before I go, I did want to discuss a common myth that epidurals can slow labor or lead to a C-section delivery, but there's no proof that this is the case. In fact, by allowing the mother to relax, there is some evidence that suggests that epidurals can actually speed up the first stage of labor. Another common myth is that the baby can be harmed by the epidural, but the amount of medication that reaches the baby from the epidural is very tiny, and with millions of epidurals used every year, there is no evidence that it causes any harm. We at Atrium Health are committed to helping you through this beautiful process of childbirth and hope you have found this video both interesting and enlightening. The use of an epidural is a choice, and we want you to have all the information you need to feel comfortable with your decision. If you have any questions, please feel free to discuss with your care team. Thank you so much for watching.